called the femoral artery, and they essentially go all the way to the branch of the femoral artery called the uterine artery, and then look at the blood vessels that are feeding the fibroids, and essentially push like beads to block off the blood supply to the individual fibroids, and that way it can help prevent the fibroid from growing, prevents the fibroid from getting like the estrogen and progesterone, and then that eventually like will like shrink the fibroid down. The success rate of these procedures with respect to how it improves people's symptoms is very dependent on the person. It's very dependent on their fibroid burden, right? And so what eventually probably will happen is like for some people, they've had improvement in their symptoms probably for like, let's say they would have it for 8 months to a year. Other people have had significant improvements in their symptoms for like years, like 9-10 years. Some people have even gone to have like 3 kids, 4 kids after uterine fibroid embolizations, right? So again, it's very dependent on the person. It's very important that like your team talks to you about what the best option could be for you. Another non-invasive procedure, low frequency ablation, and that's a sonata versus an accessa. Sonata means radio frequency is done through the vagina and targeting specific fibroids inside of like the uterus. When we're doing this, the accessa through the abdomen, we get to the fibroid and we push, like it's almost like hot waves, and that's the radio frequency that like helps like shrink the uterine fibroid down.